you believe it? So does that make it the 10th cup of care for us?
Indeed, I think it could be the 9th. But yes, a few. Yeah,
Yeah,
a few.
quite a few. How on earth did that happen? That kind of means that we've only got, just because we were going to do it until January, weren't we? So
Yeah,
time is
just a
just
couple of months.
flying.
It
So,
certainly is. Good afternoon.
yes, tell me a little bit about where you are, what kind of specialities that you're going into with your training at the moment, and
Yeah, so
just share that
I'm
with me.
right at the end now of year 2. So
Mhm.
I've got 4 more weeks of placement left to do, and that's me done for the year. So I've got 2 weeks on a placement called it's called a Simman placement. I don't know if you've ever heard of that.
No.
It's where they use a doll, but it's not just a doll for the CPR like people are quite familiar with. This doll can actually they can put you in all kinds of simulations. Like, I've done it before in university where we've had simulations where it was a deteriorating patient, so you can see the heart rate going up and the blood pressure going down and the respiration rate going up on this doll, and you work with other students, and you come up with what you diagnose
That's
and you're
amazing.
treated. It's a really good simulated environment, because of the massive range of simulations you can do. So it means that you can cover anything that you can cover on a ward, but you're in a very safe place to do it because it's not a real patient. But you learn so much, and I think the thing about it is because it's a life-size doll with a face and it's talking to you, you start to
Oh,
forget that
no.
it's a doll, and you start responding to it like it's a real patient, and you talk to him or her, and you get the information that you need. So if it's less like a paper exercise where you think, what would you do if, you're more in that moment and you feel like you're in that moment, but obviously there's nothing to go wrong.
That's
So it's
absolutely brilliant. I mean, even with Resusciani, I think she's called,
yeah, yeah,
when we're all doing our basic life support, that's always kind of felt quite real, particularly when you start having conversations, can you hear me? Can you hear me? And you kind of, think
yes,
that you're actually doing one. I think
yeah.
that's brilliant. That's so leading edge. I'm not everybody
It
can
is.
have that, surely.
No, I think it is quite a new thing. Certainly for our trust, I think our trust is one of the first in the country to do it. And I think people from other trusts come to us, and they use it not just for students, it's for staff training right across the whole trust in every discipline, because it's that versatile that you can use it in so many scenarios that everybody can benefit from it, no matter really how many years nursing experience you've got. It's just an ideal learning environment they're getting really good reviews about it.
Absolutely wonderful, and just kind of changes it up a little bit, and it kind of feeds into the people promise about using technology in a much better way within healthcare. That's a
Yeah,
perfect example, isn't it? That's really, really
yeah,
amazing. Cool. Okay, so I know we've got a couple of things that we want to discuss today, but I thought we could maybe start with an article that you'd read that one of our lovely nurses had written a little while
yeah.
ago in Nurses.co.uk on the platform, that was talking about the cost of loans, student loans
Mm,
for
mm,
nursing.
yeah.
And I know you had a couple of things that you really wanted to talk about with regard to that. So,
Yeah, yeah,
you
yeah.
know,
As you know, I used to be a careers advisor, so this is a topic that is really close to me and my background. And one of the things that I was always very passionate about when I was a careers advisor was that there are many reasons not to go to university, but finances should never be one of them. um, People have this idea. We see a lot of other people's systems, like the system in America, where being a student is a very expensive process, and they have to pay that money back. And we kind of think, when we now have student loans in this country, we think, oh, it's going to be very similar to that. Well, it isn't. It isn't similar to that at all. People think about course fees and say, well, course fees are very expensive, £9,250 a year in England. But they think, well, how am I going to pay that back? But the point is that the way the UK student loan system is set up, it's best not to think of it as a loan. It's better to think of it as a tax, because when it comes to paying it back, people will pay it back through their salaries, which means it's dependent on what people earn. And the main thing to remember is that there are three things about UK student loans that I want people to really understand, that like three headlines. Because when you understand these three things, it puts the whole student loan thing into perspective, and you realise that they are nothing to worry about at all.
Mm-hmm.
So the first big thing to say about UK student loans is that you will repay your loan over a period of 30 years. This is for people who are starting right now. There are some different terms and conditions for people before now, but we won't worry about them because they know what they've signed up to. We'll talk about what it's like for people if they were going to be doing it next year. So they will repay their loan over 30 years. And at the end of those 30 years, if they have not finished paying their loan, it will be written off. Right? It doesn't matter how much you've got left to repay, whether it's all of the loan or a tiny bit of the loan, it will be written off. Okay, so that's the first big thing, and that affects everything else that you think about student loans, because it means that there is no incentive for anyone to pay off their student loan early, because it's going to be written off after 30 years. This isn't a swizz, it's not a cheat, it's the way the government has set it up. And again, this is why we shouldn't think of them as loans, because we don't have the same incentive to pay them back as you do for other loans like car loans or mortgages. So that's a really important thing.
It's amazing, Janet. I have 3 children who are grown and have all 3 of them gone through university. My youngest just completed his degree this year, and my middle is actually doing his master's. And I have never, it switches the whole thought process by calling it a tax.
Yeah.
And I think that's really powerful. And I've never thought of it like that.
Yeah.
But there would surely be very few people that after 30 years would still have money left, surely.
Well, this is the second point, and this is where it ties into calling it a tax rather than a loan. The second point is that as a graduate, you will pay back 9% of your loan over a set wage. Every year, the government sets the minimum that someone has to earn before their loan becomes repayable. So at the moment, that is set at £27,667. So if you earn less than £27,000 a year, you are not going to pay any of your loan back. Okay, so if you don't take a graduate job from university, if you take a job that's only paying you £15,000 a year, you will not pay back anything, because you have not reached the £27,667.
So that's also a band 5, isn't it? On the first level of band 5 is below that.
As a nurse, you will probably be almost at that level when you get your first job. Maybe your first job might be around 25,000. So you won't be at that level. You won't pay back any student loan at that stage, not until you reach that level of 27,000 and the bit. Next year, it might be set at 28,000. By the time people have finished university from starting next year, it might be set at 32,000.
And is it actually going up in increments? Is it?
Yeah, because it's generally going up because of
inflation,
wages going up and the cost of living going up. So that threshold does rise a little bit in line with what everybody is paying generally. So that's the threshold at the minute, £27,667. Let's say your job was £30,000, right? So you're over the threshold, you're going to pay something. You're going to pay 9%, but you're only going to pay 9% of the difference between 27,667 and 30,000.
Oh, wow.
Right. So that, I've written it down, that is a total of £2,333. You are going to pay 9% of £2,333.
That's now under £200.
Yeah, 9%, that's exactly right. £209.97 is what you're going to pay back. A year, not a month, a year.
Wow.
Right?
Thank you so much for explaining that. That's incredible, because
Yeah,
that makes it very attractive.
indeed it does. If you were earning £100,000 a year, then you would pay 9%
I wish.
of of £70,000, which would be about £700 a year. But if that's not a massive amount, if you're on
Yeah.
£100,000,
Yeah,
and if you're
definitely.
on a hundred
And that's
thousand pound,
over
you
a
can
month.
afford to
Over a
do
month.
it. Yeah,
Wow.
and that is a year. It's not a monthly total. It's a yearly total. So you can see how you are not going to pay back a lot.
Thank you
Yeah,
so much. That is incredible. I'm blown away. And like I say, I have 3 children I'm not
yeah,
even sure they know
yeah,
that. I don't
yeah,
think
yeah.
they know that.
Maybe not. Maybe they're worrying about these repayments they're going to be making. But and again, people say then, well, if I'm only paying back £209 a year, how am I ever going to pay my loan back? But the point is, you don't
You
need
don't
to,
have
because it's
to.
going to get written off after 30 years.
Hallelujah. It's that's just so insightful. And that makes,
Yeah.
you can just see people running for the application form now to be.
As they should be, as they
Yes,
should be.
absolutely.
Yeah.
And
And
as we
so,
so need them to be. Yes.
indeed. So the other corollary of that is, well, people start to think, well, but I've got this huge amount of debt hanging over my head for, even if it's for 30 years, that debt is still hanging over my head. But the good news is, it does not register on your credit score.
I did know that. And that again,
Yes,
yes, it's just tick, 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 all
it
three
really is.
points.
Yeah,
Um, why
yeah.
why do you think that it's not kind of common knowledge?
I
Or
think it's a lot of it is because it's too good to be true. It sounds too good to be true. It, these, where else would you get terms and conditions like this? And it's not something that's that well publicised. Maybe because it is actually a cost to the government. Maybe they don't want to publicise it. I don't know. But I think as well that we are kind of conditioned into this idea that debt is bad, that you accrue loans that you have to repay, these terms and conditions must just be some kind of a unicorn, a myth,
yes,
but actually all of that is true, and you can read all about this. There is ucas.com, there is gov.uk, there is moneysavingexpert.com, which is Martin Lewis's website. These are all very reputable sources of information that will tell you all of this, everything that I've said. But when you know those 3 pieces of information, that your loan is going to be written off, that it doesn't affect your credit score, that even when you do make repayments, they will be very small, that changes the whole landscape, especially for people like me who are coming in from existing careers to start again, with families, with growing families, with people with children of their own that are going through university at the same time as them in a lot of cases. All of this changes the outlook on whether you choose to go to university or not. Like I said, there might be many reasons why you decide not to go to university, but it should never be because you feel like you can't manage the student loan situation.
absolutely. And so where does the £5,000 bursary come in?
Yes. Mm. That's a very good question, because that is a bursary that is available to all nurses. It starts at £5,000. Being a bursary means that it is non-repayable. You will not have to pay back any of that £5,000, and it's £5,000 a year. So if your course is a 3-year course, it will be £15,000. Now, if you do mental health or you do learning disabilities, they actually give you more than £5,000 to do that. And there are additional amounts that get added to it for, I think, if you've got children or if you've got other dependents. And if you do something like you have to go to a placement that is further away than your university, then you can claim back some of your expenses for having to do that. So that £5,000 is a minimum £5,000 per year, and you don't pay that back. It's a bursary, it's a grant. So that's really good news as well. The current top limit on student finance is £12,667 a year. That's the maximum, but that is means tested. So if you live at home with your parents, that figure will be reduced because there's an expectation that parents will help fund their children's living costs. My husband has to pay a contribution towards my living costs, so I don't get the maximum either. But the bursary can help top that up. And in addition to that, depending on your circumstances, again, there are other ways to access other funds as well to live on. So there is lots of help and support out there in terms of financial support for university.
Wonderful. And again, people might not know that. So it's a wonderful opportunity to come into nursing, because it's kind of so many things are stacked in your favour to encourage you to go through that system. And then, you know, obviously, as we've discussed before previously, you also, after an initial period of time, I think it was maybe 6 months at the beginning, joined NHSP, so that you could substantiate, you know, you could also bring in income as well.
Yeah.
So, and is that still working out quite well for you? Are you doing, how many shifts would you say that you're, or how many hours are you managing to do? Or
it depends which point in the year it is. When I'm on placement, I don't do any shifts at all because 3 long shifts a week is enough for me. But I'm not at placement at the moment, so I've been picking up some shifts. I've got a really good relationship with a local eye clinic that I've developed through NHSP, so I love going there, and so I've been going there for the last 3 weeks. But also I pick up shifts on a Sunday in the hospital, because that way I get the a bit more clinical experience of the ward as well. So that's the lovely thing about NHSP, is that it's so versatile and that there are so many different shifts that are available through it. If you want to work nights all the time, there are loads of night shifts available on NHSP. If you want days, if you want shorter days, that's all possible. I very rarely, in fact, I don't ever do a long shift on NHSP. I only ever do 6 hours, which suits me great right now because I am juggling different things with the study, the travelling. I still groom dogs as well, so a 6-hour shift suits me great. But I have lots of friends who do the full 12-hour shifts, and they do them through the night, and that fits in well with their family life and everything. So yeah, it really works out well for us.
fantastic. So I was just, it's such an enlightening conversation, and I really hope that really encourages and inspires people, you know, wherever they might be in their life or in their career, to consider nursing. Of course, it's October now and would have missed this year's intake, but sometimes it takes quite a bit of time to get yourself sorted. So it's a good time at this time of year to start looking for, you know, September intake for 23. So,
absolutely, people will be writing UCAS applications now, ready for next year. And the thing I always tried to instill in people when I was a careers advisor, you need to be armed with information. You know, you need to know what all the things are that are coming up. And when people rightly raise concerns about the barriers in front of them, it's important that they understand what those barriers are, because quite frequently you can work around the barriers, but people don't always have the information to hand, or they think they know, but actually it's because they've been looking at another country's system rather than the UK system, you know, where it is particularly unique to us, this way of dealing with student loans. And I suspect it's because until it's only the last 25 years that we've had student loans. Before that, everybody did go to university for free. And while they did introduce these student loans, it's kind of been a way of saying, yeah, we'll make students pay, but actually we'll not make them pay. You know, so it's like this, it's a halfway house between paying and not paying, but actually we don't pay. You know, maybe they do really need to reword it so that that's more obvious, because that's the situation. Like I said, it's not a swizz, it's not a cheat.
It's a tax. It's a
Yes.
tax. Yes, it's a
Yeah.
really, really good way of looking at it. And also, it's not going to affect your ability to get your mortgage and that kind of
No,
thing. And
no, quite right.
that is, well, I mean, that just opens up. So, I think probably what happens is people talk about it and they take on other people's thoughts and beliefs around it rather than looking into it themselves.
Yeah.
So, as happens with many things, really. But
Yeah.
no, that's amazing. Thank you so
And as
much
you
for
say,
sharing that.
that's no problem at all. As you say, the one of the big things is that people who have got students' loans still do believe that they're under massive pressure, which is such a shame that they believe that, because it's ruining their mental health when it doesn't need to. And there are people who have got loans and they still don't understand that actually the pressure is not what they think it is at all. So if there's anybody who's got a student loan that doesn't realise that they're not going to be under massive pressure to pay it back, I'd love for them to realise that, because that can be a massive weight that can be lifted off people's shoulders.
Well, I can think of a young person, a young man that will be having that conversation at about 7 o'clock this evening when he gets back in from work, and he'll be absolutely delighted. He'll have made his day. And I, that's also kind of a bit bad from my point of view, being his mother, that I really should have known that too. But then, to be honest, as an adult, he should have that information at his fingertips, and I think that's what we're saying. It's not easily available. Yeah, no, we need to share. Fantastic. So the next thing, how long have we got? Let's see, about 20 minutes or so, 15, 20 minutes. I just wanted to talk about nursing as a profession. And I wanted just to kind of think about what being a professional kind of means to both you and me. And yeah, just open that conversation. And I'm going to pin it around the Nursing and Midwifery Council's Code of Conduct. That every nurse who revalidates every year will know very well, because all their work, everything they do, is based around that code. And actually, that's part of being a professional, is that you have a group of people that live like a shared education in what we're just talking about now, through a degree or certain competencies and levels of education together, at the same time as having a whole set of values, both those things together. So there's a standard that's set, i.e. you have to be a qualified nurse and registered, and there's then values that underpin that all work together, and that's what makes a professional. But it's an interesting word, because obviously you have professional golf players, you have professional, there's professions all over the place, and everybody has a different thought of what it means, and there's no 100% correct way, it's just your way. But I thought we would just kind of talk about it, because there's sometimes the thought possibly that not all nurses feel like they are professionals in comparison to maybe lawyers or accountants. And I wonder why that is, and if that is the case, how has that degraded us as a profession? And I just wonder what you thought about that.
Wow, that's nebulous, isn't it, really? I mean, we use the code a lot at university. Most of our written work involves using that as an underpinning basis, which I find really useful. And I guess I'm still coming to terms with what exactly is a nurse. Because I knew nurses before I started training. I'd come into contact with nurses as a patient, but it is quite a hard thing to define, and there are lots of definitions out there. Like I don't know, I suppose we kind of we think we know what a solicitor is. We think we know what an accountant is, but do we? It's really only maybe when someone gets into the actual details of what someone's job is. And the thing about nursing is that it's so vast and so many different opportunities exist in nursing. And there are so many different characters and personalities in nursing as well. It's not just one type of person that gets attracted to nursing. It's so many, like right across the spectrum, that you think, well, how can that person who is so different from that person, how can they both be nurses? And yet they're both brilliant at their jobs. And I think what I'm starting to think is that actually a professional nurse is somebody who has that flexibility, even within their own role. Because if you ask any nurse, there's very few that would say, oh yeah, I know exactly what I'm going to do tomorrow. It's going to be the same as what I did today. Very few nurses say that. They're more likely to say, I don't know what's coming tomorrow. And that's one of the things that I love about my job.
Yes, because we're dealing with human beings and we just don't know how they're going to be at all, you know.
Exactly.
That's the beauty of it in a way.
Yeah. And maybe professionalism works on different levels. Like you can say that the work that we do is of a standard that it should be called a profession, because it's very technical and it's very skilled and it's very knowledge based,
and evidence based, as you say.
Yeah. But then on another level, you can be professional. Anyone can be professional in the way they present themselves in their work, in the way they deal with situations,
how you show up.
People.
Yeah.
So and sometimes I think unprofessional behaviour or an unprofessional mindset is sometimes more about an inflexibility to cope with differences that you've come across, the inability to cope with the different patients, because you see 5 patients in one day and they will all require different things of you as a nurse, and being able to respond to all 5 in the appropriate way, that's quite a skill. And it's not a letdown if you don't manage to respond to all 5 in the appropriate way, because we're not perfect and there will be times where we don't miss the mark. But nurses strive to achieve that personalised care of all their patients to the best degree that they can. And I think that's sometimes where professionalism comes in, is being able to represent all those different needs to the best of your ability.
Yeah.
Does that make sense?
Yes, it really, really does. Yes, I think you're absolutely spot on. And it's interesting with the code because the way it's written, so the first, you know, they don't come in any particular order, but practicing effectively is such a big piece, really. But I find it so much easier to reframe that as being accountable. And within that, so you've got your your problem solving, your ability to challenge, to be reflective, and to look at everything from an evidence-based perspective. So just being accountable, for me, that helps me an awful lot. And the same with the next one, which is promoting professionalism and trust, which is really what we're talking about. But that really is being a leader. And that's another way of reframing that. You know, it's leading yourself and leading others. And I think that's another really good way of looking at it. So it's looking at how you're autonomous and how you coordinate, how honest you are, how innovative you are, and looking at thinking through systems and that kind of thing. That's a perfect example of being a leader. The next one is prioritizing people. But again, I like to reframe that as being an advocate, because you're actually advocating, emotional intelligence, competencies, resilience, compassion, and the ability to be kind of impartial in situations. So that, again, that's being an advocate for your people, not just for yourself, but also for your staff around you and for your patients and for your families to a degree as well. And then preserving safety. Again, I like the being analogy. That's really about being competent, about looking at your technology, using critical thinking, using appreciative inquiry, those kinds of things. So it's when you put all of that together, and you realize that every piece of our work is based around these four pillars, if you like, the four codes. Yes, that is such a professional person, someone that can advocate, be accountable, lead, and be totally competent. That is hats off. And I think with professionalism comes a certain degree of respect. And I don't know how the general public feel about this. We know how they felt about it in COVID when they clapped for us. But it was more, when you think that someone's taken 3 years or many, many years of experience to get to that level of competency, and they have those values that are kind of innate within them that we've just described, that really is a very professional being, isn't it?
Yeah, so it's a very rounded professional as well. Those values are very much set up to reflect the whole range of personality, really, aren't there? And at different aspects of the role. And you can see how some people are better at some aspects of all of that than others. Like you can be the most compassionate person and the most attentive nurse, but you might not be the strongest leader, or you might not be the most outspoken, or you might not have the greatest background of knowledge, but all of those things are easy to work on. And this is I feel like sometimes this is the thing, is that it's a bit of a wish list of things to tick off, like, are you a good leader? Are you a confident person? Are you compassionate? Do you know your evidence base? And if it turns out that you can tick the first three, but you have to honestly say, well, I haven't read a journal in the last year, well, you know that's something that you can
know
deal
exactly
with.
where you're at. Yeah, because you can't have it perfect. It's this is part of that wonderful thing of reflection that all of us nurses are so good at. It's actually, that's part of it, is kind of thinking, okay, so like you say, the checklist is there, but I need to get stronger at this, and this, and this is what the reflection has shown me.
And then there's an element of plate spinning in there as well, isn't there? We've got all of our plates spinning nicely, and then all of a sudden a little bit of a catastrophe happens with one of the plates, so we focus on that, and our eye comes off the ball with some of the other things, and maybe we do something that's a little bit uncharacteristic of us because we've taken our eye off that plate and we're focusing on another one. But that's the beauty of the reflective nature of it, and the being able to reassess where we are at any one time, the skills that we have at this moment in time, and do we need to, right, that plate's spinning again now, do we need to go back and respin an earlier one that we were always very confident with, but somehow that's got left behind, so we need to revisit. It's a very dynamic process, just to say that you're a compassionate person in your first year of nursing. You ask any nurse who's been nursing for 20 years, compassion fatigue, that's a real thing, and the ability to maintain that level of energy 20 years later, it's a dynamic process, and it's a constant monitoring of which plates are spinning and which ones do we need to give a little tweak to and re-energize.
I love that. Absolutely love that. I always love everything to do with well-being, etc. But I think you're absolutely right, because it's easy to work along a framework like the code of conduct. But I think also being a professional, allows us to acknowledge when we need to have more time, more self-care, more ability to rest and recuperate, so that we can come back fresh. I think that's part of being a professional, is being able to bear witness to that ourselves, knowing what we need in order to flourish and be the best that we can be. And obviously, that's a big challenge for a lot of people at this very moment in time. But again, a professional person, you can't put yourself in a situation where you're unsafe. And
No.
if you are totally burnt out, then you have to hold yourself accountable to that, and you have to take some action or ask for support, or there's lots and lots of things that can be done. Really, really interesting. And of course, the really great thing is that when you come to get your passport, and you need someone to witness your photograph, alongside the accountants and solicitors and the teachers, there's the nurse as well.
The
So
nurse,
the
yes,
nurse is
yes, we
there
are that
too.
prepared.
So that's really, really good. Oh, absolutely wonderful. I just wanted to finish by saying, just continuing this idea on. I know normally sometimes we talk about this separately, but I'm just thinking about our next conversation. And because of your background in career work, and because of the role that I do for Nurses.co.uk, I wondered if it would be interesting and helpful to talk about keeping that professionalism going by considering building a portfolio. And I wanted to know what kind of support you get as a student in creating a portfolio, if anything, and why it's actually quite important as you move forward and you look for your first job to potentially have that alongside a CV.
Wow. Well, we haven't had anything like that yet. But I don't know, maybe it's on the curriculum for year 3. And I guess because this is what nurses need to do anyway for their revalidation. So I have a feeling that we will have some input on that next year, but we haven't done a great deal of that at the moment.
Would you be able to look into the curriculum and see if it's a component? Because
Yeah.
I'm just thinking it might be helpful to talk about it as an additional kind of piece that helps you to stand out in your chosen field when you're going for an interview. And just some thoughts behind why, like you say, it's a great thing to put together, because you'll always have it and you'll be building it on it as you go. It's not a requirement. I don't think it's necessarily a requirement. I need to look into it further. I haven't heard it is, but I think it could be something that could be really beneficial for people to have. So what I mean by the portfolio is having things like, any additional qualifications or trainings that you've been involved in, a little bit about, your kind of personality and people outside of the nursing profession that might give you recommendations, maybe some letters or notes, if it was appropriate, from patients or relatives that had seen something that you've done. Things like when we talked about much earlier in the year, when they were doing notes and things on a wall, those kind of ideas. So just so that you've got it in one place, it's in one file, that it's portable, that you can take with you. And if you were sitting in an interview situation, you could imagine the panel flicking through it. So it's not necessarily the norm, but it never needs to be the norm. You have to do whatever it takes to go where you need to be. So
I will find out. I'll do some research before next time.
perfect. As always, Janet, the sun is shining across your face now, so you're all lit up. No, all lit up. We don't want, it's October, we don't want to get rid of it, but it's probably a really good time for us to say goodbye. Have a lovely weekend, and a spooky Halloween. I hope your little doggy's okay. With this time of year is always a bit challenging with fireworks and things.
Just keep them in the evenings. That's biggest advice. Do not walk at night. Just be with them, love them, and just keep them as relaxed as you can. It's not my favourite time of year for that very reason.
Yes, I'm sure.
But yeah, but Milo's really good about it, and we just keep him safe.
Oh, lovely. So lovely to be with you as always. You take lots
You
of
too.
care. Thank
Thank you
you.
very much.
Okay,
Bye bye.
bye.